If someone is exposed to sulfuric acid, fast action and the proper first aid can go a long way toward minimizing burns and saving a life. Anybody exposed to sulfuric acid needs to get to an emergency shower immediately. Fast action is essential. If your colleague needs assistance and you're wearing the proper PPE, go ahead and help. You must have on appropriate PPE before helping your colleague. It does no good to have two victims. Exposed workers need to be under the emergency shower at least 15 minutes with their eyes open and their contaminated clothing removed. Forget modesty. The contaminated clothing must be removed to get the acid away from the skin. If your eyes are exposed to sulfuric acid, get to the nearest eye wash station. Your lids must be held apart while the eyes are flushed for at least 15 minutes. Don't hesitate to get someone to help you with this. If there is an exposure, make sure somebody contacts your site's emergency number. When all the acid has been washed from the exposed areas with water, the burns can be treated using wet, ice-cold compresses until further medical help is available. Avoid freezing the burned area. Immersing the burn in ice water is also effective. If the injury is located on the hands, arms, or other parts where immersion is practical, make sure you periodically remove the limb to prevent over-chilling. Watch for signs of shock with the exposed person. While sulfuric acid at room temperature doesn't give off vapors, acid mist may come from hot solutions or reaction tanks. Inhaling these vapors is harmful to the lungs and respiratory tract. Workers exposed to these vapors should be moved to fresh air immediately. If they're having trouble breathing, keep them warm and comfortable. Find a qualified person to administer oxygen. Symptoms of lung injury can be delayed. If the person has stopped breathing, administer CPR. It's important to take immediate action and seek medical attention. If you or a colleague is exposed to sulfuric acid, remember, every second counts.